Well, it's been a long time coming, 30 years in fact. But this week, hundreds of former Whakatane sawmill workers exposed to harmful chemicals were told their health conditions are recognised as legitimate by the Ministry of Health. It means they will receive some government support for their health care, but after turning down an offer of compensation earlier this year, it's not clear whether another offer will be on the table. In the meantime, though, the former sawmill workers say they want whatever support they receive to be extended to their families as well. Will that happen? With me in Auckland is former Whakatane sawmill worker Hemi Wilson. Joe Harawira, spokesperson for Sawmill Workers Against Poisons, is in Rotorua, while down in Wellington is Sally Gilbert from the Ministry of Health. Tēnā koutou, welcome to the programme.
Kia ora, Shane.
Joe, let's begin with you. It's been a long fight for you. How pleased are you with what's been offered?
I'm very pleased. I'm very pleased for the fact is that at least now we'll be all at the table and heading in the same direction. I'm pleased also that there is facilities within the components that have the ability to allow us to progress.
When you say progress, what do you mean? How do you think progress has been achieved?
Well, first and foremost, the recognition, I might add, is the biggest step forward. It's probably one of the biggest milestones in the 30 years that I've been on this kaupapa. And I think just to divert a bit, the second one is the recognition also from the Ministry for the Environment regarding our sawmill contaminated sites throughout New Zealand.
So the recognition that you are seeking, it's been confirmed. In terms of the assistance package that has been offered, your thoughts about that?
Like I say, I'm happy with what's been put in front of us. And again, I'd like to reiterate that there is room for us to progress in there, considering regarding the components that were delivered to us on that day.
Hemi Wilson, I know you've got something to say before I ask you the first question.
Yes. Nō reira ki waku hoa koe ne rā te mihi atu kia kōta ko hinga atu nei kōtou I roto e ne Whakatane pāna kia tātou I tēnei wā. Nō reira kai konei mātou e pukurire ana ki te kāwana mo e ne Whakatane. Nō reira kia kōtou nā mate haere. Kia tātou te kanuhora kai te whakanatunu mātou mo kōtou. Nō reira tēnā tātou katoa. Kia ora.
Kia ora, and thank you for that. In that piece there, you acknowledged a lot of your colleagues, former colleagues who worked with you at the sawmill, who have now passed on. Yes. And you also referred to the living who are still fighting this battle. It's been also a long fight for you. Tell us about it.
Yes, this goes right back to around about the 1968, I think, when they actually found it out and we knew about it. But the thing about it was that the company never acknowledged our thoughts. It wasn't until around about the 1980s, early 1980s, we actually found out that this substance or dioxin that we were working with was very poisonous. And it was only through some of our workers dying, getting their feet amputated, their legs amputated, and going through the stage of mawiri amongst themselves. And then we started arguing about it. And I'll take my hat off to Joe Harawira, who fought for 30 years to try and get this acknowledged, and which I'm really pleased about it. We've heard about it now that most of the workers now are supporting Joe and supporting their team, and we who have been working with the mill for so long are finding it quite happy. We are quite happy now that the government are at least listening to us for what's happening within our family itself. The part I've really miss out, feel sorry for, are our children, our mokopuna, because they used to play in it, they used to swim in it, and we didn't even know anything about it. And also the dump sites that they had around Whakatane, none of us knew that they were dangerous, but we all lived there, built houses next to it without knowing the effects later on.
So your contention is that your own tamariki, your mokopuna, have been affected
Yes.
by PCP?
Yes, and the thing about it is some of them they still can talk, but I mean their growth has been stunted, and that's the part I don't like about the one of my mokos. Her father's about 6'6", the mother's about 6 foot, and she's a 3-year-old, and she's no more than about that tall, you know, and it really upsets me, but she's got the brains of a 3-year-old and talks well.
So you can see it with your own eyes?
Yes, yes. And the thing about it too, Shane, is that I've seen quite a few other children with their parents who have now passed on, and it shows within their system also. And the thing about it, all we wanted was to get compensation, not compensation, but to get free medication for us, for our children, plus our grandchildren. And that's what we've been fighting for ever since. And Joe has also been following that up also, but he had other things that he wanted to bring forward within.
And that's why you're upset, you're angry, that the package that was laid out on the table last week doesn't go far enough. It doesn't cater for your children and your grandchildren.
And lower and more great-grandchildren also. Yes, I was upset for the simple reason the people who were on the table there, they shouldn't have been there. It should have been the government. We should have been speaking to them, to the government people that was there at the time. But we were talking to these people who have been of the District Health Board and all that.
And from the Ministry of Health.
Yes.
So you were disappointed that no one from the government showed up, showed their faces, confronted you with this issue?
That's right. And the thing about it that we're still arguing, why didn't they turn up?
Sally Gilbert, thank you for joining us down in Wellington. You represent the Ministry of Health. Tell us, does the Ministry of Health recognise the genetic effects of PCP?
At this stage, the information we have about intergenerational effects is not clear. What we're hoping to do is actually call a lot of people together, people from SWAP, from Ngāti Awa, Health and Social Services, from research and academics, and actually talk to people about what are the questions that we need to answer and how are ways that we can actually start answering those questions and gathering information. Some of it may come from overseas, but if there's questions that we can answer in New Zealand, then we would want to look at how we can do that and think about what we can do to support the former sawmill workers and their families.
How much work has been done thus far to look at those effects?
There has been quite a lot of work done internationally. There's been a little bit of work done in New Zealand, but the information's still not clear. We do look at what happens overseas, but at the moment there's not a consensus among the scientists and the researchers, and so at this stage it's very hard to think what we could do and what would be effective in helping people.
So does that mean that we don't have the methodology to carry out this research?
Some of it is not having the methodology, but I think we would also want to talk to people like Joe and actually find out what are the exact questions that we need to answer. So it's not us coming and saying, well, these are the issues and this is what we're going to do. It's actually asking people what they think and where they think we can be most helpful.
You've just heard Hemi Wilson talk about his own kids, his own grandchildren. He says he sees it every day, the effects of PCP on his own kids. Do you not accept
that? Certainly we accept that there are strong health concerns, there are certainly health effects in the community, but what we need to do is find out what might be contributing to those health effects so that if there are different exposures that are going on still in the community or exposures in the past, that we actually do something to help people stay well, to help people that are sick, and also make sure that we protect people in generations that are still coming on.
But I suppose therein lies the point, because it's taken so long for the ministry to reach this point, to actually recognise the effects on sawmill workers.